Welcome to this comprehensive clinical masterclass. Today, we dedicate 10 minutes to a deep investigation of hirsutism, from its molecular origins to the latest evidence-based treatment protocols. Our curriculum is extensive. We will master the pathophysiology of hair transformation, differentiate causes across the lifespan, and establish a global standard for ethnic-sensitive diagnosis and care. This lesson is strictly grounded in the latest research. We synthesize data from PubMed meta-analyses and international guidelines to ensure your practice remains at the technical frontier. Act 1. To treat hirsutism effectively, we must first understand the remarkable biological transformation that occurs within the pilosebaceous unit. Hirsutism is not about growing new follicles. It is the androgen-driven transformation of fine, unpigmented vellus hair into coarse, pigmented terminal hair. The engine of this change is dihydrotestosterone, or DHT. Within the follicle, the enzyme 5-alpha reductase converts testosterone into this significantly more potent androgen. DHT binds to androgen receptors in the dermal papilla, prolonging the anagen phase. This results in the longer, thicker, and more robust hairs that define the condition. New research highlights genetic hypersensitivity. Variants near the FGF5 gene can cause follicles to overreact even when circulating androgen levels are perfectly normal. We must also look at insulin. Hyperinsulinemia reduces the production of sex hormone-binding globulin in the liver, leaving more free testosterone to act on the skin. Act 2. The presence of excess hair in children requires a different clinical lens, as it often signals early endocrine maturation or serious rare pathology. Premature adrenarche is often the earliest sign, where the adrenal glands begin producing weak androgens prematurely, leading to early hair development. We must screen for non-classic congenital adrenal hyperplasia. This genetic condition causes an overproduction of androgen precursors, resulting in rapid hair growth. During early puberty, mild hirsutism can be a normal variant. However, persistence 2 years post-menarche is a primary indicator for PCOS in adolescence. In children, rapidly progressive hair growth accompanied by signs of virilization is a critical red flag for rare androgen-secreting tumors of the ovaries or adrenals. Act 3. In the adult population, our investigation focuses on metabolic syndromes and the profound shifts of life-stage hormonal transitions. Polycystic ovary syndrome remains the clinical anchor of adult hirsutism, accounting for approximately 80% of all cases we manage. Idiopathic hirsutism affects women with regular cycles and normal androgens, typically driven by overactive enzyme activity within the skin itself. During menopause, the drop in estrogen shifts the androgen to estrogen ratio, often triggering the appearance of new terminal hair in older women. We also look for secondary causes like Cushing's syndrome, where excess cortisol production leads to secondary and clinically significant androgen excess. Medication history is vital. Drugs like certain progestins, anabolic steroids, or even minoxidil can exacerbate or induce unwanted hair growth. Act 4. We must move away from universal diagnostic thresholds. Multinational research has redefined how we score hirsutism across different ancestries. In East Asian populations, where follicle density is naturally lower, a score as low as 2 is now the threshold for diagnosing hormonal imbalance. Conversely, in Middle Eastern and Mediterranean ancestries, thresholds are set higher, often at 10 to 12, to reflect higher natural prevalence. 2024 digital cohort studies confirm significantly higher prevalence rates in South Asian and Hispanic populations compared to Northern European ancestries. The 2025 FinGen study has identified strong genetic risk factors linked to both hirsutism and metabolic traits like insulin resistance and type 2 diabetes. We must formally recognize the psychological toll. Hirsutism is a major driver of anxiety and body dysmorphic disorder in women worldwide. Act 5. Our management strategy is three-pronged: androgen suppression, androgen receptor blockade, and advanced mechanical hair reduction. Combined oral contraceptives remain our first-line monolith, increasing SHBG to effectively clear bioavailable testosterone from the system. When COCs are insufficient, we add spironolactone. This competitive inhibitor guards the follicle's receptors, creating a powerful pharmacological synergy. The results of this synergy are remarkable. 2025 data shows an average 60% reduction in scoring over a 3-year period. We have officially abandoned metformin as a primary hirsutism treatment. Recent meta-analyses confirm its efficacy is too limited for this purpose. We are looking toward the new metabolic frontier, GLP-1 receptor agonists, which indirectly lower androgens by dramatically improving insulin sensitivity. Mechanical removal is the vital third prong. The alexandrite laser is clinically proven to be the gold standard, far outperforming IPL technologies. For non-pigmented hair, electrolysis remains the only permanent solution, while topical eflornithine acts as a daily inhibitor of follicular growth. Our management pathways are equally structured. This comprehensive table details our therapeutic arsenal, from first-line systemic medications to advanced topical and mechanical options. Standard immunoassays are often insufficient. Liquid chromatography tandem mass spectrometry is the forensic standard we demand for all our free testosterone assays. To ensure forensic accuracy, our androgen and CAH panels utilize liquid chromatography tandem mass spectrometry. This detailed protocol allows us to map the precise hormonal triggers driving the transformation. Moving further, we assess ovarian and pituitary function alongside a critical metabolic screening. These markers are essential for identifying PCOS-related risks and excluding secondary endocrine cofactors. Diagnostic excellence is the foundation of our success. Precise assays and personalized scoring lead to outcomes that transform lives. In specialized cases, such as early childhood presentation or rapid virilization, we employ targeted genetic testing and high-resolution imaging to rule out disorders of development or malignancy. At Alketa Licollari, our mission is to translate the depth of global research into the highest standard of evidence-based dermatological care. Medicine is about more than just managing symptoms. It is about providing the evidence-based tools our patients need to reclaim their confidence. Deep within the root, the interplay of growth factors and steroid receptors determines the follicle's ultimate fate. Precision is found at the molecular level. For a routine presentation, this first-line panel identifies the vast majority of causes. It provides the diagnostic foundation from which we tailor any further specialized investigations. Even with identical hormone levels, differences in androgen receptor activity can lead to vastly different clinical presentations. We must understand these individual variances. Low aromatase activity and localized androgen production within the skin can create a hyperandrogenic microenvironment, even when systemic levels remain normal. Upholding the highest ethical standards is fundamental to our practice, ensuring that every patient is treated with the utmost dignity, privacy, and clinical respect. The future of hirsutism care is constantly evolving. We remain at the forefront, integrating new research to ensure our patients always have the best options available. I invite you to join us in this evidence-based journey. Let the research lead the way toward a more precise and compassionate future for our patients. This masterclass was inspired by the pursuit of global clinical excellence. Thank you for your commitment to learning and to the highest standards of care. Thank you for joining me for this 10-minute masterclass. I hope these insights empower your clinical practice. Until next time, I am Dr. Alketa Licollari. Gruppo Clinico Licollari, precision, purity, and clinical mastery, leading the way in modern dermatology. Good